This is a very interesting case. Let's see how well you can guess. So this is a 28-year-old female. She had gone to one of the famous cardiac hospital with the complaints of chest pain. There she was detected a myocardial infarction, heart attack. So later they treated for heart attack and they sent home. So the patient came with complaints of swelling over the elbow regions to us. So when we saw the patient, we examined. There was a subcutaneous nodules over the extensor regions like elbow, then the foot. So on also examination there was a arcus senalis. So history-wise, there was a significant history of premature cardiac death in her father. So her father passed away at the age of 45 due to MI, and also her sister also had an MI. So what could be the diagnosis? What do you think of? So patient had a early MI. Also there's arcus senalis. There's subcutaneous nodules. So what was our thinking was there could be a probably a cholesterol deposition. They are the tendon xanthomas. So whatever you see in the picture, they are tendon xanthomas. Xanthomas are nothing but a fatty deposition in the subcutaneous tissue. And also arcus senalis is there. Arcus senalis is nothing but a deposition of a fat over the surrounding cornea. So this will be seen in a very old age, but we have seen this patient at a very early age. So we suspect something related to probably familial hypercholesterolemia. So we sent a lipid profile. Lipid profile was showing total cholesterol, very high total cholesterol in the range of 500s, and also LDLs in the range of 450, triglycerides in the range of 230, and also HDL levels are reduced. So we confirmed it's a familial hypercholesterolemia, primary hypercholesterolemia. So in hypercholesterolemia topic, there are two types: primary hypercholesterolemia, secondary hypercholesterolemia. Primary hypercholesterolemia is inherited genetic mutation condition. In that familial hypercholesterolemia is there, familial hyperlipidemia, combined hyperlipidemia is there. In familial hypercholesterolemia, LDL levels are raised. In familial combined hyperlipidemia, both triglycerides and LDL are raised. In secondary hypercholesterolemia, it could be secondary to diabetes, hypothyroidism, obesity, nephrotic syndrome. So in this patient, we confirmed primary hypercholesterolemia, probably familial combined lipidemia. So it could be a probably due to overproduction of ApoB100 mutation. For this patient, we started on statins and fenofibrates, and we discharged the patient. She's better now.